Hello, this is Dr. Terzic. I'm Dr. Terzic, Carmen Terzic. I'm the chair of the Department of Physical Medicine and Rehabilitation at the Mayo Clinic. And it's for me a great pleasure to have today Dr. Kate Stolp, which was the current chair, the previous chair of the Department of Physical Medicine and Rehabilitation. And she is now the elected president for the AAP. And we would like to welcome her and ask her about the AAP and some other questions regarding our specialty, physical medicine rehabilitation. So, Dr. Stolp, thank you for being with us today.
Thank you, Dr. Terzic, and it's wonderful to be here as president-elect of the Association of Academic Physiatrists. The AAP is actually our academic arm in this specialty. So we represent programs to promote research and education that supports our clinical practice. And also we are able to represent our organization and our specialty in some of the other national organizations in organized medicine. And this gives us a seat at the table. So as the American Association of Physical Medicine and Rehabilitation serves many aspects of our specialty and largely the clinical practice, the AAP really focuses on how do you support the academic departments, the department chairs, the residency program directors, medical student teaching, and research, even teaching people how to do research, get research grants, how to write grants, and tries to keep those academic aspects alive in our busy days.
As a president, future president of the AAP, what do you think are the challenges or the opportunity that our specialty will have in the years to come?
Well, I think the biggest thing our specialty faces currently is that what we do really is improve quality of life for the patients we see and the people we serve. I think we really take patients from being patients to returning to the community as people. We teach them that having a disability does not mean they're sick. It means they may have a challenge that they need to live with, but they can move into quality of life despite those limitations. And our job is to help them get there. And I think one of our opportunities is in this era, I think more and more people are realizing in the practice of medicine that much of what we do in terms of curing disease has been accomplished in some respects. And now we have issues with people just living with certain conditions, and how do we make it possible for them to live with excellent quality of life? And so our focus has always been on the person within the context of their family, within the context of the community. How do we return them to being productive members of the community? Our focus has been on outcomes. What difference does it make if we do a procedure, we put them on a drug? Does it really improve quality of life? And many times it does, sometimes it doesn't. And we can extend that to really get people engaged again with others in the community, help them adapt, help them really serve their families, serve their employers, be productive members of society. And that's what's important to patients and people. We all want to know we have a role, and our job is to return people to that role. That has not been the focus for so many years of traditional medicine, and I think today the reality is that we need those things to happen, but the biggest challenge is that I don't think everyone is ready to pay for that. Mm-hmm. I think the insurance companies, the third-party payers, our governmental agencies are still trying to get their arms around how do we handle that. And one of the challenges the AAP deals with is how do we teach that, and how do we do quality research when we're trying to assess something like a functional outcome or quality of life, which is scientifically hard to measure and measure accurately.
Yeah, yes. And this is what makes our specialty a very special one, is that we don't see, I think that we don't see the individual like a disease, it's the whole context, social context, family context, and how to bring them to a quality and productive life, despite the medical problem that they are dealing. Well, we are very glad that I know that you have a busy calendar, and we are very glad to have the opportunity to talk with you. And we are very proud, the Department of Physical Medicine Rehabilitation is very proud to have one of our top physicians to be a leader in the national organization in this specialty. So we thank you for that, and we are so sure that we are going to do a wonderful job for the whole specialty. Thank you.
Thank you very much, Carmen.